Now we will read about the temporal bone. This is temporal bone. It lies in the parasagittal plane. It is the bone of the skull and it forms the temple of the human skull. That's why called temporal bone. Its anatomical position in the human body is that it forms the lateral side of the skull and its longitudinal axis lies antero-posteriorly such that from the internal surface one triangular process is coming out and it should face forward and medially. This is the anatomical position. About the side determination, there is triangular process medially and laterally from anterior to posterior there is zygomatic process, external auditory meatus and mesquite process antero-posteriorly, and this lies medially. So this is medial and this is lateral. Antero-posteriorly zygomatic process, so this is anterior and this is posterior, and mesquite process should face downward, not upward. So this is inferior and this is superior aspect. So this is of left side, left temporal bone. Now about the parts, it has got 5 parts. The flattened squamous part. This is the rough posterior mesquite part having the mesquite process in it. The thin plate like tympanic part. Rough projected. This is the petrous part, and there is one styloid process coming on the inferior aspect of this petrous part, just behind the mesquite process. From here it is broken here, styloid process going downward and forward like this, styloid process. So it has got 5 parts: squamous part, mesquite part, petrous part, tympanic part and the styloid part. First come to squamous part. It is flattened. It has got one fossa and one process, and this plate like part has got external surface, internal surface, antero-inferior border and the superior border. On the external surface, just above the external auditory meatus, there lies a crest, suprameatal crest. This is external auditory meatus and this is suprameatal crest. Over the suprameatal crest, this is the suprameatal crest. Okay, 5 cm above, and it give attachment to the temporalis fossa, and all over the external surface there is attachment of temporalis muscle. The process, this one, the zygomatic process, it articulates with the temporal process of the zygomatic bone to form the zygomatic arch. It has got lateral surface and the medial surface, superior border and the inferior border. Over the superior border, again there is attachment of temporalis fossa, continued here from up to here. The inferior border as well as the medial surface or internal surface give attachment to the masseter muscle. Posteriorly, this border, inferior border, diverges into 2 limbs, and at the junction where from it diverges give rise to one tubercle which give attachment to the lateral ligament of the temporomandibular joint. Just a fossa just behind this zygomatic process, this is called the mandibular fossa. which articulate with the head of the mandible, or you can say condyloid part of the mandible, to form the, like this, head of the mandible to form the temporomandibular joint. This is the articular part of the mandibular fossa, and this one is non-articular part. So this is, it articulates with the head of the mandible to form the temporomandibular joint. Now, about the internal surface, there is impression, vascular marking, and there are two vascular marking. There is anteriorly, and this is for the anterior meningeal vein, and this is the middle meningeal vein. This is for the middle, and there is some elevation, depression. It is due to the sulci and gyri of the temporal lobe of the cerebral hemisphere. Okay. Now, antero-inferior border, it articulates with the greater wing of the sphenoid, as well as the parietal bone. The anterior part of the inferior border of the parietal bone, and here at this point, this is called pterion, and this superior border articulates with the inferior border of the parietal bone. Okay, so this is about the border, surface, process, and one fossa. Now coming to the mastoid part. This mastoid part has again the external surface, the internal surface, the superior border and the posterior border, one process. This is the mastoid process. Okay, and in between the mastoid part and the squamous part, there lies the tympanic part, this one, which forms the external auditory meatus. This is the tympanic part. This is squamous and the mastoid part. It joins to form the squamomastoid fissure. Here lies the squamomastoid fissure. Okay, and this on the external surface, in between this squamomastoid fissure and the suprameatal crest, there lies attachment of auricularis posterior muscle, as well as the occipital belly of the occipitofrontalis muscle. On this mastoid process, it has got lateral surface. This is the lateral surface and this is the medial surface. On the lateral surface, there is attachment of sternocleidomastoid as well as the semispinalis capitis. Okay, and on the medial surface, there is attachment of posterior of digastric. Just behind the mastoid process, there is one groove, as well as this one. This is the notch. Groove lodges occipital artery, whereas the notch lodges posterior auricular branch of the vagus nerve, which is also known as ulnar nerve. Okay, and there is one foramina here. This one. This is called this is the foramina. This is known as mastoid foramina, through which one emissary vein passes, which connects the sigmoid sinus with the suboccipital venous plexus. Now, coming to the tympanic part. This and about the border, this superior border again articulates with the inferior border of the parietal bone, and this angle forms the asterion. Asterion asks for OTP. That is, asterion is formed by the union of the occipital bone behind, parietal bone above, and the anteriorly there is mesquite part of the temporal bone. So OTP. Okay, asterion. And the posterior border, it articulates with the occipital bone. Okay. Now on the internal surface, there is one groove. This one. This groove which loses the sphenoidal sinus. Sigmoid sinus. And there is one foramina, this one, which is the internal opening of mesquite foramina. This one. Okay. Now coming to the petrous part of the temporal bone. It has got anterior surface, posterior surface, and the inferior surface. This one from here to here. One apex, this one, and one base, which is intermingled with the laterally squamous and tympanic and the mesquite part. This is a pyramidal shaped process which runs forward and medially and downward. This is the petrous part. It has got one apex, one base, three surfaces: anterior surface, posterior surface, and the inferior surface, as well as the three border: anterior border, superior border, and the posterior border. The anterior, this is the anterior surface from medial to lateral. This medial, there is a, here is a groove which loses the, this is called the Michel's cave, which loses the trigeminal ganglion. After that there is a depression. It lies over the internal auditory meatus. And there is an eminence after that. This is called arcuate eminence, created by the ampulla of the posterior semicircular canal. Just in front of that, this anterior surface is formed by a thin plate. A thin plate, this one. This is called the tegmentum tympani. It has got lateral opening and one medial opening. Lateral opening is for the lesser petrosal nerve, lesser superficial petrosal nerve, which is the parasympathetic component which carries parasympathetic fiber for the otic ganglion. It is coming out from the middle ear cavity after making tympanic plexus over the medial wall of the middle ear cavity over the promontory, forming tympanic plexus, and one parasympathetic fiber is coming out from this hiatus, and then it runs over a sulcus. This one is faint sulcus, and which is directed towards the foramen ovale. Here lies foramen ovale. So this, it runs like this. Okay, and now this opening is for the greater superficial petrosal nerve, and this is the hiatus, and this is sulcus up to this much, and it is coming towards the foramen lacerum. So this is the hiatus for the lesser superficial petrosal nerve. This is for the greater superficial petrosal nerve. It is coming towards the foramen lacerum, where it combined with the sympathetic nerve, that is sympathetic nerve around the internal carotid artery, because here at the apex there is, this is the internal opening of the carotid canal, and it accompany the sympathetic nerve coming along with that. That is called the deep petrosal nerve, and after that it enters into the pterygoid canal, which also starts from the foramen lacerum. Okay. Now this thin plate-like bone, that is the tegmentum tympani, it come outside on the medial side of this fissure. On the medial side of this fissure is in between the tympanic part and the squamous part and the tympanic part, so called as squamotympanic fissure. And this tegment tympani, this thin plate, it bifurcate this fissure again into two parts, anteriorly petrosquamosal fissure and posteriorly petrotympanic fissure. Posteriorly petrotympanic fissure give way to one cat, that is the C for cauda tympani nerve, A for anterior ligament of malleus, and T for anterior tympanic artery, coming out from the petrotympanic fissure. Now coming to the posterior surface of the petrous part of the temporal bone, internal auditory meatus. This is 1 centimeter deep canal, internal auditory meatus. And at its medial most end, it ends here. At its medial most end, after entering it through it, it just end here on the medial most, and here it is divided by one horizontal plate and again by one vertical plate and give rise to 4 quadrant. Anteriorly from here lies the facial canal. This is for the superior vestibular nerve. Here is the inferior vestibular nerve and foramen singulare, one is small, which carry the ductus lymphaticus. And here lies the foramen cochleariformis, which give way to the cochlear nerve. This structure is lying deep to this canal. Internal auditory meatus give way to the 7th and 8th cranial nerve as well as the labyrinthine artery. And the posterior most end gives the way to the sigmoid sinus. On the inferior surface, this large opening is known as the carotid canal. This is the external opening and here is the internal opening. It opens into the foramen lacerum. Meter to the carotid canal, external opening. Here is the attachment of the tensor veli palatine muscle. And this is the carotid canal through which internal carotid artery passes, and after that this forms the jugular fossa, forming the anterior boundary of the jugular foramen, through which anteriorly there is inferior petrosal sinus, posteriorly there is sigmoid sinus, and in the middle compartment 9th, 10th and 11th cranial nerve passes. Okay, this is about the here. Okay, and this also here also there is bulb of internal jugular vein. And here at the apex, this opening is of the internal opening of the carotid canal, and just anterior to that there is 2 opening. This is the opening here. This one just below that. This upper one is for the canal for the tensor tympani, and below this forms the bony part of the auditory tube, and this is canal for the tensor tympani. Both are semi-canal separated by a common septum. Okay, and this apex lies in between the greater wing of sphenoid anteriorly, and posteriorly there is occipital bone. And this is the superior border, give attachment to the tentorium cerebelli, and also lodges the superior petrosal sinus. And from here to here up to the jugular fossa, here lies the inferior petrosal sinus. and opens into the internodular vein, and it is supposed to be the first tributary of the internodular vein, inferior petrosal sinus. And there is attachment of tentorium cerebelli. Mesquite part here, from here, anteriorly and the inferiorly, and as well as the somewhat medially. One spicuous like process, a spine like process passes, that is called the styloid process, which give attachment to the three muscles and the two ligament. Three muscles, anteriorly styloglossus, posteriorly stylohyoid, and medially stylopharyngeus muscle. Styloglossus supplied by hypoglossal nerve, stylohyoid supplied by the facial nerve, and stylopharyngeus supplied by the glossopharyngeal nerve. Three different nerves. And the two ligaments are stylohyoid ligament derived from the second pharyngeal arch, and a stylomandibular ligament, which is a thickened part of the deep cervical fossa. Okay, and all these together, the three muscles and the two ligaments, form the styloid apparatus. And these two ligaments are attached at the tip of the styloid process. So this is all about. Thank you.